Constipation is a very, very common problem. If you ask at random a mob of 100 people, you will find it present in 60 to 70% of them. Now, what exactly is constipation? Is it the hard stools which is difficult to peel past every day? Is it that the person have to push for the motion, that is called constipation? Is it the sense of incompleteness after passing motion, which is called as constipation? Is it the sense of blockage while passing stool, that is called as constipation? Now, there are various definitions and it differs from person to person. What does a normal person do when they have constipation? They will just use some dietary changes, they will use some household remedies, they may go over the counter and buy some medicines, and nowadays all these internet, mobiles, Google and everything, they will just go online and search for it. Yes, it is a double-edged sword. It will help, but it can be detrimental also. Why? Because as and how the natural response of the nerves and the coordination of the intestine and the anus have been masked by all these medications, it leads to just aggravation of the symptom. To such an extent that sometimes there is no urge felt and people have to take some 20 tablets or some one and a half bottles of whatever syrups and everything are available to just have one single bowel motion. That also is incomplete. And certain times they may have to put in a finger just to pull out the whole stool which is obstructed inside. So where is it leading and why is it happening so? Just because of the single reason that nobody knows or nobody has thought about to find out the basic reason of constipation. Like if you have a fever, we will just go and find out whether it is a malaria or dengue or typhoid or something. And accordingly the treatment is absolutely easy. But for constipation, it is just a merry-go-round around and around the bushes and you don't even get relief at all. That is why you see, ask any patient, for how long have you been constipated? They will never say I have been constipated since the last 1 week or 2 days of time. They will say I have been constipated since my young age or childhood or since years ago. The basic reason is nobody actually goes into the depth of it to find out what is important. So friends, medical science, surgical science has advanced so much that now we can identify the basic cause of constipation. We have various investigations, and now I have to announce that it is available in India. We have inorectal manometry, we have MR diffibulography, we have the pudendal nerve terminal neuromotor latency test available. And there are a host of other crap labs, that is the colorectal and anal physiology lab testing, which help us to identify what is the basic reason of the constipation. Now once we know, once we get to the bottom, once we diagnose the problem, then it becomes easy to offer the universally or the scientifically proven methods of treating constipation, which is not always surgery. It is a holistic approach which includes dietary changes, lifestyle modifications, and the integral part is where our team comes into the picture. Dr. Nishant, who is a pelvic floor therapist. Here, all the nerves and the muscles and their strength and their sensitivity and their coordination, which has gone for a toss, that can be regained. We have terminal motor latency stimulation, we have tibial nerve stimulation, we have transrectal and perianal Faraday stimulation, a host of pelvic floor exercises and yoga and breathing techniques, and so many. He is an expert in that thing. And we have found that nearly 70 to 80% of the patients, they have found relief just by all these things. And yes, when there is a sliding of the rectum which is blocking the ends, or there is a pouch in the wall of the rectum which is accumulating all this stool, and there is a loss of coordination which is visible on this investigation, there comes the role of a surgeon, where we can offer staple transanal resection rectopexy, we can offer laparoscopic ventral mesh rectopexy, to just put all the structures, the pelvic structures or the organs back into their position and get back in their normal function. Plus Botox or botulinum toxin relaxation of the muscles, which is not allowing the anus or the rectum to open up during passing motion. That is possible. So yes friends, constipation has a surgically curable domain. Constipation can be surgically corrected, provided it has been investigated properly, the diagnosis made accurately, and an experienced proctologist or a colorectal surgeon takes care of it. Thank you very much.